Thank you, Annalise. Well, good afternoon again, everyone. Thank you so much for joining us. I'm Annalisa Perez Hudgens. I serve as Vice President of Quality at the New Jersey Healthcare Quality Institute. I am joined by a couple of my team members here, Program Officer Christine Ivory, who's in the background, and Annalise Slater. Both are working kind of behind the scenes to support this event. We do like to start with just a couple of housekeeping items. So all phone lines will be muted for the duration of the program, really to just limit background noise, but you are more than welcome to ask questions. If you want to come off mute, just let us know. We will have time at the end just to kind of open it up for questions, but you can feel free to put any questions into the Q&A box. You can send a private question to Christine or put it in the public chat box, and we will pose it to Missy at the end of her presentation. We will be sharing the slides with all attendees. They will also be available on the Quality Institute's website under resources, and then we're recording the session, so we will make sure to share that out with all of you as well. For those who may be new to us, and Annalise, you can go to the next slide. Thank you. Who may be new to us, the Quality Institute is a nonprofit membership-based organization working to improve the safety, quality, and affordability of healthcare for everyone. And so our members come from all sectors of healthcare. We have about 120 members, give or take at any time, that we really bring together to work on whatever we're working on, whether that's we're working on a quality improvement initiative or talking about healthcare policy, making sure your traditional healthcare clinicians and providers and organizations are involved, as well as what may be considered non-traditional. We have an education council, we have a technology council, we have a consumer council. So really making sure that we're bringing those different perspectives together to work on a topic and come to consensus as a team. Our work falls into three main areas. Policy, the Quality Institute's policy work spans areas such as payment reform, child and maternal health, and advancing Medicaid. We also have community health. Our two signature programs are our Mayor's Wellness Campaign and Conversation of Your Life, where we work with local leaders across the state to advance the health and wellness of their communities. And then quality improvement, which, as many of you on the call know, is that catch-all for really advancing healthcare quality and patient safety across the state. So we work really closely with facilities, community partners, providers, and staff to support meaningful, sustainable quality improvement. That includes offering guidance. We share best practices, create opportunities for collaboration and learning through work groups or initiatives, educational programs, or sessions such as this one. The Quality Institute does serve as the regional leader for the Leapfrog Group in New Jersey and New York. We all know that ASCs play an increasingly critical role in our healthcare system, delivering more than half of all surgeries and often at a lower cost than hospital-based care. But like any organization providing care, there's always those opportunities to celebrate our strengths and really continue to improve. And so using the Leapfrog ASC survey as an important tool to really promote transparency, again, just demonstrating and acknowledging all of the work that you're already doing, your commitment to safe, high quality care, but also allowing you to benchmark that performance and identify what are those opportunities where we can strengthen our safety and quality efforts. So whether you're new to the survey or kind of revisiting it, we just want you to know that we are here as a partner. We're always happy to provide technical assistance, answer questions. Oftentimes people lean into us to connect them to peers, to other facilities who are maybe doing well in a particular area. And we will always want to do what we can to support your team's quality and safety goals. Related to Leapfrog, but beyond that too, as I mentioned, we do a lot of quality work in the state. So thank you again for being here. We look forward to working with you. But it is my pleasure to introduce our speaker, Missy Danforth. Missy is the Senior Vice President of Healthcare Ratings at the Leapfrog Group, which is based in Washington, D.C. They are a not-for-profit organization representing the nation's largest employers and purchasers of health benefits, working to make great leaps forward in safety, quality, and value of healthcare. So at Leapfrog, Missy serves as a member of their senior leadership team, really informing their strategic direction, engaging different stakeholders, and looking at program results to drive safety and quality improvements. And oversees numerous public reporting activities, including the Leapfrog Hospital and Ambulatory Surgery Center surveys. So with that, I will hand it off to Missy, who will talk to you all more about their new ASC Public Reporting Program and what those changes mean for not just for you as facilities, but for consumers across the state as well. So thanks, Missy, for joining us.
Thanks so much, Adelisa and Annalise. I'm very, very excited to be here. We've been working on the redesign of this program for what seems like months and months and months and months. Just to give you a second of background about where we started, back in 2019, we actually launched our first Leapfrog ASC survey. We had amazing engagement from ASCs across the country. That year, we committed to doing no scoring or public reporting, but really giving ASCs the opportunity to get to know Leapfrog and the survey itself, and announced that in 2020, the survey would be launched at full scale, and there would be scoring and public reporting. On, I think, March 16th, 2020, the world pretty much shut down due to COVID-19, and ASCs were particularly impacted. In many communities, ASCs were closing or having their facilities and equipment repurposed to deal with the global pandemic. Since that time, we've really tried to work closely with members of the ASC community to think about the best path forward. We know that more and more surgeries are being performed in ambulatory surgery centers. At this point, it's upwards of 70% of all surgeries being performed on a same day basis, and many of those in freestanding ASCs. Many of our employers and purchasers want and need safety and quality information as they're trying to make decisions about benefit design as well as network design. Many of the payers that we work with also want this information. And importantly, patients and healthcare consumers as well. And so for the past several years, we've really tried to take in all of the feedback and think about the best way forward to both engage ASCs in patient safety and quality reporting, and then in turn, have meaningful information available for all of those different stakeholder groups. Next slide. Really key to those conversations has been our ASC Advisory Committee. We launched this ASC Advisory Committee in 2021 as a way to really make sure we were getting the right kind of feedback and information at the right time to help inform our decision making. The ASC Advisory Committee formally advises Leapfrog on key issues related to safety, quality, and efficiency to make sure that our key constituents have the information they need to make decisions. The committee has been integral. They've actually been meeting quarterly over the past year. This is a volunteer committee. I really cannot thank them enough. They've been meeting quarterly over the past year to help us advise us on this new ASC Public Reporting redesign that I'm going to talk to you about today. As Adelisa mentioned, she's going to be distributing these slides to you all, and you can find a list of our members, which includes representatives from New Jersey on our website. Next slide. So with their input, as well as the really tireless work of our research team at Johns Hopkins, and contributions from two of the largest ASC accreditation organizations in the country, AAAHC and the Joint Commission. I'm really excited to talk to you about the three components of our brand new ASC Public Reporting Program. Next slide. So over the past 5 years, the only way ASCs could really engage with Leapfrog was by participating in our annual voluntary survey. And this new ASC Public Reporting Program really seeks to expand the level of engagement ASCs can have with Leapfrog. And this program really represents our vision for what we're calling a journey of progressive transparency. Or at a minimum, this year, Leapfrog will be scoring and publicly reporting data from the CMS ASC QR program for thousands of ASCs, regardless of their participation in our annual voluntary survey. Additionally, ASCs can take literally 5 minutes and come to the ASC dashboard on Leapfrog's website to provide some brief demographic information and upload their accreditation documentation from AAAHC or the Joint Commission, and be additionally publicly reported as achieved the standard for 5 important safety measures. And then finally, we are maintaining the Leapfrog ASC survey and relaunching it as the ASC Survey 2.0. We've cut the volume of survey reporting in half, but continuing to maintain key measures that are critically important to patients and purchasers, but really allowing, I think, an appropriately phased engagement for ASCs over these three different program components. Next slide. So the first component is really the CMS publicly reported data. So we've been hearing from ASCs as well as ASCA, which is the National Association for ASCs, frustration over the fact that thousands of ASCs participate in the CMS ASC Quality Reporting Program, but CMS does not publicly report those data on Care Compare. CMS's publicly reporting website, Care Compare, continues to be limited to hospitals and long-term care facilities and nursing homes, but ASCs and their data are not searchable on that website, and that's been frustrating for ASCs doing this work and doing this public reporting, doing quality measurement for CMS, making it available for public reporting, but then CMS doesn't actually provide an outlet for consumers and others to search and find that information. And so the first component of our new ASC Public Reporting Program is really based on feedback we've been getting from ASCs over the past 5 years about this frustration. And we are going to, at a minimum, get that information from the CMS provider catalog, score it using benchmarks that we've established by assessing the distribution of performance nationally. We're going to public report on a 4-level scale, where achieve the standard is the best score, limited achievement is the worst score. And now people who come to Leapfrog's free public website, leapfroggroup.org, can actually view that information, select up to 3 facilities, and compare it side by side. And this is really our effort to give a home to those previously unsearchable, unusable data, and really in direct response to some of the frustrations we've heard from individual ASCs, ASC networks, as well as the National ASC Association. Next slide. We are also going to be highlighting certain national accreditation standards. We undertook a month-long set of work led by our researchers at Johns Hopkins to do a deep dive into the accreditation standards for the 2 leading accreditation organizations to start, AAAHC and the Joint Commission. We did an extensive review of their accreditation standards with measures that were formally included on the Leapfrog ASC survey. What they determined that there were 5 measures formally from the Leapfrog ASC survey, so will require data collection and reporting to Leapfrog, where the accreditation standards were either substantially similar or in some cases even more robust. And those standards include certified clinicians in advanced life support being present in the facility at all times while there are patients, the use and efficacy of a safe surgery checklist, medication and allergy documentation, leadership structures and systems to support patient safety, and the identification and mitigation of patient safety risks. So these 5 measures formally collected on the Leapfrog ASC survey were found to be substantively similar, or in some cases, the accreditation standard was even slightly more robust. And so in 2026, ASCs that visit our website, leapfroggroup.org, and access the ASC dashboard will be able to provide some basic benchmarking information, upload their proof of accreditation, and be publicly reported as achieve the standard, that highest score, for these 5 measures. And so over the course of 5 minutes, you will have hopefully at a minimum that CMS ASC QR data as well as this accreditation data now available for the public, folks that you are doing contracting with, and we're really, really excited to be able to do that. Next slide. And then finally, as I said, we are maintaining the Leapfrog ASC survey, but have substantially overhauled that survey. The Leapfrog ASC survey 2.0 only includes now 8 measures, not available from any other source. And so these are things that we just can't get from CMS. the accreditation standards don't adequately address these areas, or there aren't even accreditation standards to address these areas. And these things include billing ethics, vitally important to patients and their families, healthcare equity, informed consent, taking responsibility for never events, so those serious reportable events, surgical site infection surveillance following breast surgeries, laminectomies, herniopathies, and knee prosthesis, as well as hand hygiene and culture of safety. And then finally, some volume reporting, both our national volume standards for total hip and knee replacement and bariatric surgery. And then we've actually removed the volume reporting for select outpatient procedures from mandatory to optional. And so what that means is that if you're thinking about doing an ASC survey this year, the volume reporting for those unscored procedures is optional. You can skip it and still submit a survey. We anticipate, based on feedback from our ASC advisory committee, all of whom do ASC surveys for the past 5 years, that the time commitment has been reduced by about 50%, meaning it's about 10 hours of staff time for data collection and reporting. Now, if you're one of those ASCs that actually has been doing the survey for 1 or more years, your time commitment may be even less if you have standardized reporting or processes in place. Next slide. So really this, I think, represents just, we hope, an amazing opportunity to get engaged in Leapfrog, and also to drive your patients, the payers that you're doing business with, the employers and purchasers that you're doing business with, and others to our website so they can see that patient safety and quality information about your facility. We have, again, reduced that voluntary reporting piece by 50%. It's about 10 hours. And we've also removed that volume reporting to optional, meaning you can skip it and still submit a survey. Next slide. At a very high level, these 3 tiers of participation, we think, really represent an entry point for pretty much any ASC in the country, where at a minimum, we're going to have that CMS ASC QR data scored and publicly reported. Within 5 minutes, we can additionally have information about those 5 measures that can be achieved through national accreditation. And then finally, in just 10 hours, representing this full commitment to transparency, if you additionally voluntarily submit the Leapfrog ASC Survey 2.0. With that survey submission, ASCs will be eligible for our National Top ASC Award. This is a very prestigious award we've been giving out for 5 years to freestanding ASCs. It is a national recognition program. We actually hold an in-person dinner and give out awards in person. And last year, 100% of top ASCs winning the award participated in that in-person dinner and award ceremony, which was extremely exciting. Additionally, all of the ASCs that submit an ASC Survey 2.0 in 2026 will receive Leapfrog's free benchmarking report. So you can actually compare your performance against other ASCs and set some improvement targets if appropriate moving forward. Next slide. We have really designed this program, or I should say redesigned this program, with some very specific goals in mind. First and foremost is making sure that we continue to maintain our commitment that participation in our ratings programs are always free to hospitals and ASCs. We have a very, very long data submission window. So you can decide to submit your survey anytime between April 1st and November 30th. And again, your results and the results of other ASCs are publicly reported on a free public website. And so you can also use that website to look up the results of other ASCs in your market or in your community. Additionally, we've maintained some comparisons between ASCs and hospital outpatient departments. So we've maintained some measures that will be comparable between those 2 facility types. Again, while being appropriate and making sure that the measures that we've reserved for ASCs are specifically designed with their specific operations in mind. All ASCs in the CMS Provider Data Catalog are eligible to participate. As I said, I'm going to be talking a lot today actually about scoring, so I'll go ahead and skip that for right now. Next slide. So I wanted to give just a little bit more detail on the CMS public reporting. Next slide. So hopefully all of you are familiar with the CMS Provider Data Catalog. This is pretty much the only place where you can find your own results for these CMS ASC QR measures, as well as the OAS CAPS measures that are now required for ASCs. Next slide. The Provider Data Catalog is basically a website where CMS makes available downloadable data sets for its various quality reporting programs for hospitals, ambulatory surgery centers, long-term care facilities, and nursing homes. Today, your data basically resides in these two downloadable data sets. And as you can see here, they're downloadable as CSV data sets. They're gigantic. They're impossible to use or to search within. They're very complex data files and not very helpful at all. We will be downloading this information 4 times a year for all of the ASCs on our roster and actually scoring it using some scoring algorithms I'm going to talk about in just a second, and then publicly reporting it on a free, easy to use website at leapfroggroup.org, so people can actually come to that website, search for you by name or location or by the types of procedures that you perform, and find this information and actually use it, which we're, again, really excited to just be able to respond to this particular frustration that we've been hearing for many, many years. Next slide. As I mentioned, we are going to be downloading these data 4 times a year because we know that CMS does update it. This will help ensure that anytime makes more current data available for your ASC, those same data will then become available on our website, leapfroggroup.org. We're going to download the data for the first time from those provider data catalogs on June 22nd. We'll score it using our scoring algorithms and then publicly report it starting July 25th. And then we'll download it 3 more times. If it's not updated, when we go to do a download, then those same data will be maintained. But again, we don't want to miss any potential update from CMS. Our commitment is to ensure that we always make available on our own website the most current information available. Next slide. In terms of accreditation, next slide, you will need to apply for a 16-digit security code so you can access that free ASC dashboard and upload that accreditation certificate. There's a couple fast, easy ways to do this. You can either submit your business license along with a security code request form to our help desk, or you can have your NHSN OPC administrator submit the request for you. Next slide. Once you obtain that 16-digit security code, you can then log into the free ASC dashboard. There is a quick set of demographic questions, and then you'll get to the accreditation section of that dashboard where you'll just be asked which accreditation your facility currently has, whether or not you're going to be uploading your accreditation certificate, and then some upload instructions. We've been testing this ourselves, and I can promise you it really does take under 5 minutes. Next slide. Next slide. Once you do this, again, it will allow us to additionally highlight your achievement of these 5 national accreditation standards that were formerly on the Leapfrog ASC survey. And so that CLA, certified staff being present, safe surgery checklist, medication and allergy documentation, and then 2 of those NQF safe practices, leadership structures, and identification and mitigation of risks and hazards have been replaced on the survey and now can be achieved through these accreditation standards. If your ASC is not accredited by AAAHC or the Joint Commission, no problem. You'll be publicly reported as not available for these measures. And we are going to be doing additional outreach to additional accreditation organizations this year to add to that list in 2027. Next slide. There's lots of opportunities to upload your accreditation certificates. You can do so now. The first accreditation upload deadline is June 30th in order to be scored and publicly reported as achieving those standards on July 25th. You would need to upload that accreditation certificate by August 31st to be eligible for top ASC. And the last time you're able to do that for the survey cycle is November 30th. So if you don't decide to do that by November 30th, you will have to wait until next year. And that's because we are actually reviewing those certificates on a monthly basis to ensure they're valid documents. Next slide. Okay, in terms of the Leapfrog ASC survey, next slide, like I said, we did significantly cut down this survey. You do need a security code to access the online survey tool. Next slide. Once you get there, you will be able to provide some contact information, and then the survey itself is organized into just 4 sections. The first section includes basic demographic information, like the total number of operating and procedure rooms. Section 2 includes questions about billing ethics, healthcare equity, informed consent, and taking responsibility for never events. Section 3 includes questions about infection surveillance, hand hygiene, and culture of safety. And then finally, Section 4 includes questions about our 3 national volume standards, hip, knee, and bariatric procedures, and then optional select volume reporting, which again is not required this year. The survey itself and the online survey tool are organized in the exact same way, so you can quickly and easily download a hard copy of the survey, including the questions and all of the measure specifications and reporting periods. Do your data collection, fill out the survey, review it with your entire team, and then once that's been finalized, entering it into the online survey tool probably takes 20 minutes or less. Next slide. The types of information that we are collecting in each of the sections, I briefly described. So actually, let's go ahead and skip these next few slides. Yeah, let's go to the reporting period or the timeline slide. Yes. So we, as hopefully you can tell, have really tried to align the deadlines for each of the program components. So the CMS, downloads and the accreditation, upload opportunities, as well as the Survey 2.0 deadlines. And so the big deadline really for all of the programs is June 30th. That's when we're going to pull down the data for scoring and public reporting for the first time across all 3 components and actually update our public reporting website on July 25th. And so that is really your first opportunity to be publicly reported on all 3 components: CMS measures, accreditation standards, and Leapfrog Survey 2.0 measures. In order to prepare you to meet that deadline, we've been doing free town hall calls. All of the materials are available on our website, but we're also doing one-on-one orientations. So if your ASC is interested in doing a survey for the first time this year and wants more information on the program, please contact our help desk. We've been on a weekly basis, one-on-one orientations to get folks prepared to meet this first important June 30th deadline. Again, if you missed the June 30th deadline, the next important deadline is August 31st to upload both your accreditation documentation and submit a survey to be eligible as a top ASC. And then finally, however, if you miss both of those deadlines, the absolute last opportunity this cycle to upload accreditation, submit a survey is November 30th. We reserve the months of December and January to finalize all of our data review across both of those components. And so that November 30th deadline is a hard deadline. If your ASC is concerned because maybe you're new to the survey year about the ability to meet that June 30 deadline, and you want to understand whether or not you can meet the August 31st deadline, that's a great reason to schedule an orientation. Our team will actually go through each section of the ASC survey with you and can talk through anticipated data collection that you would need to do and help you estimate resources that might be required. But again, we think in total it's going to be less than 10 hours. and as the majority of ASCs starting now will likely to be able to meet the June 30th deadline, but absolutely be able to meet that August 31st deadline. And again, for those of you that may need to set up more structures or want to put some more formal data collection processes in place, you do ultimately have until November 30th to do that. Next slide. So I promised, and I do really want to talk now about scoring. So let's specifically start with what it means to score and publicly report that CMS ASC QR data. Next slide. So as I mentioned, and hopefully all of you have seen it, the CMS ASC QR data is available on that provider data catalog website in 2 downloadable CSV files. One includes ASC 1 to 4 and the other ASC outcome measures. The second file includes the domain scores for those OAS CAPS domains. Both of those files include things like reporting periods and sample sizes, as well as your rates, percentages, or results for each of those measures. As I mentioned, we are going to be downloading the CMS data 4 times a year, beginning on June 22nd, and we're using published scoring algorithms to do scoring for each of those measures. And you can download that document on our website today, but I did bring some screenshots along with me. Next slide. So for the CMS ASC QR measures, as I mentioned, we are using benchmarks that we've developed with our researchers at Johns Hopkins that are based on the national distribution of performance, so all ASCs, performance across each of these measures. And so, for example, so for ASCs 1, 2, and 3, so this is patient burns during an ASC visit, patient falls during an ASC visit, and then wrong site, wrong side, wrong implant, etc. In order to be scored and publicly reported as achieve the standard, your ASC would have to have no applicable events, meaning in the ASC QR file, your rate is represented as 0. And for most ASCs, that's the case. There's opportunity to earn partial credit. As I said, it is a 4-level scoring scale, where achieve the standard is the best score, considerable achievement is the next best score, some achievement is the 3rd highest score, and then limited achievement is the lowest score. For ASC 4, which is all cost transfer, and ASC 12, 17, 18, and 19, which are those unplanned hospital visit measures. And so ASC 12 is unplanned hospital visits following a colonoscopy. AS 17 is unplanned hospital visits following an orthopedic visit. ASC 18 is unplanned hospital visits following a urology procedure, and then ASC 19 is unplanned hospital visits following a general surgery. To be scored and publicly reported as achieve the standard, you need to be in the top quartile based on all ASCs in the CMS ASC QR file that have a score for that measure. So again, in this instance, you're only being compared to your peers. So Leapfrog isn't establishing some artificial cut points. We're really using a very common scoring method, looking at quartiles, and to achieve the standard, you will need to be in the top quartile performance. And then finally for ASC 14, which is unplanned second surgery after a cataract surgery, in order to be scored and publicly reported as achieve the standard, you need to be in the top 50th percentile or better. So I think very generous scoring cut points. Additionally, I should note historically Leapfrog has frozen cut points once they're established for at least 3 years. So is that as your facility improves on each of these measures over time, you can see that improvement reflected in your publicly reported results. And so that means the cut points established this year for these measures will likely be frozen for the next 3 years. And as your performance on these measures improves, your publicly reported information on Leapfrog's website will improve as well. Now on the AOS CAPS domains. There's 4 domains that we're going to be using from CMS: facilities and staff, communication about your procedure, patients' rating of this facility, as well as patients recommending the facility. In order to be scored and publicly reported as achieve the standard, you need to be in the top quartile based on your top box score for all 4 of these domains. And again, we're setting those top quartile benchmarks, looking at the overall performance of all hospitals and ASCs who have OAS CAP scores for each of these 4 domains. So again, really a very simple peer comparison methodology. Next slide. For the accreditation measures, again, you'll automatically be publicly reported as achieved the standard. Otherwise, you'll be publicly reported as not available if you are not accredited by AAAHC or the Joint Commission. Next slide. And then finally, for the Leapfrog measures, we use a variety of scoring algorithms for each of the 8 measures. However, I did want to share one example with you today. And so within the ASC Survey 2.0, as I mentioned, we do have an infection surveillance measure. This specifically assesses whether or not ASCs that perform breast surgeries, laminectomies, herniopathies, or knee prosthesis procedures are participating in NHSN's outpatient procedure components module, completing the OPC annual facility survey, and actually entering monthly reporting plans for their SSIs for each of the applicable procedures. Now, if your ASC doesn't do any of these 4 procedures, easy. When you get to this question in the survey, you just say, we don't do any of these procedures, and you'll be scored and publicly reported as does not apply. However, if you do these procedures, in order to achieve this standard, we are looking for you to be entering those monthly SSI reporting plans for the full 12-month reporting period. We've had this on the ASC survey since 2019. So a lot of the ASCs who have been doing the survey are already doing this. If you're new to the ASC survey and just engaging with NHSN for the first time, you'll see there's lots of opportunity to earn partial credit. And so maybe if you just started entering monthly reporting plans into the NHSN's OPC component, you can still earn some achievement on this measure in public reporting. And then as you continue to enter those monthly reporting plans, obviously, you'll see those scores improve over time and be reflected in your publicly reported results. All of these scoring algorithms for all of the CMS measures, the accreditation standards, and each and every measure included in the Leapfrog ASC Survey 2.0 is available in a downloadable PDF document on our website, leapfroggroup.org/ASC. So as you're going through the ASC Survey 2.0 and filling out that paper copy of the survey, you can actually follow along in the scoring algorithms document, and you'll know exactly how you're going to be scored and publicly reported for each and every measure before you ever hit that submit button in the online survey tool. And so we really have tried to make it easier for you to understand exactly how you're going to be publicly represented. And if you have any questions at all about our scoring algorithms, again, please reach out to our help desk to schedule one of those one-on-one orientations or submit a ticket to the help desk. Next slide. So at Leapfrog, again, because we want to make sure that people are using our publicly reported results, that they are representative of high quality data submissions, we have several verification protocols in place. So first and foremost, for the CMS ASC QR data that we've been talking about, prior to each release, right, meaning prior to when CMS makes these data available in the CMS provider data catalog, they make those data available to you all in a 30-day confidential preview period. This happens approximately 2 months before it's available on data.cms.gov. Therefore, we are not doing any additional data verification on the CMS data. That is CMS's responsibility. They give you an opportunity to review it, ask questions about it, etc. Once it's publicized by CMS, we consider it final, and we're not doing any additional data verification on it. However, for the accreditation certificates, once they are uploaded to the ASC dashboard, we will be reviewing them to ensure they have not expired, they are valid, they're accurate, they represent the business name that we have you listed under, etc. If our team identifies any issues with the certificate, we're going to contact the contacts that you listed in the ASC profile within the first 7 business days of the month following your upload. Okay, so we are going to be checking each and every document to ensure they are valid, up to date, and represent the business name associated with your ASC based on what CMS has listed for you all. If we send one of your contacts an email indicated that we find an issue with the document that you uploaded, the score for those measures will be updated from Achieve the Standard to pending Leapfrog verification until you've re-uploaded a current valid certificate. So we have actually been reviewing these. We received a lot of them in April and had no issues so far. But again, because we're publicly reporting as Achieve the Standard for these 5 measures, we need to make sure that the information is accurate and correct. Next slide. For the Leapfrog ASC Survey 2.0 measures, because these are voluntary self-reported data, we have a much more robust protocol in place. So first and foremost, an online affirmation of accuracy needs to be completed by your facility administrator before the survey can even be submitted using our online survey tool. Within the online survey tool, we have electronic warnings built in. So we're looking for inconsistent responses, potential data entry or reporting errors, and we will produce a list within the online survey tool if we think we found anything. Our help desk on a monthly basis reviews all of the responses submitted via the online survey tool, and if we find any data abnormalities, again, this could be very high values, very low values, inconsistent reporting from year to year, etc. We will contact the folks you have listed in the survey profile with a data review message that does need to be responded to. Additionally, we send out monthly documentation requests to ASCs to document various responses from the ASC Survey 2.0. So for example, if you say that you're doing hand hygiene observations every month throughout the facility, you may be contacted to submit those logs to our help desk. And then finally, for a very small number of ASCs, we do on-site data verification. Those ASCs are contacted in June by our third-party verifier. They're called Metastar. They schedule a half-day visit with your ASC. Those are held in September and October. We've been doing this for several years. It is not overly onerous. These are scheduled, not surprise visits. Like I said, they typically only take a couple hours, but it's a great opportunity for us to give payers, employers who want to use this information in network design or contract negotiations, even more assurance that the data that they're using is accurate and high quality. Next slide. And then finally, public reporting. So I've been talking a lot about scoring and public reporting. So I talked to you about how scoring happens. Now I want to show you what public reporting looks like. So Leapfrog has a free public reporting website. That website will be updated for 2026 for the first time on July 25th. Then it is updated monthly within the first 7 business days of the month. And so that allows us to reflect new CMS data, newly uploaded accreditation documents, as well as new or updated ASC survey submissions. Next slide. The website is at ratings.leapfroggroup.org. When you get there, you can search for facilities by name, location, by a specific same-day procedure type. We want to make it easy for folks to find you, or you can use our guided search function. ASCs that don't submit the ASC survey by June 30th will initially be publicly reported in July as declined to report, as we've always done. But then as soon as you submit the survey within 7 days of the following month, the website will be updated with your scored results. Next slide. We use these 4 performance categories in scoring and public reporting, and we denote them on our public reporting website using cell phone bars, where 4 filled bars is achieve the standard, 3 filled bars is considerable achievement, 2 filled bars is some achievement, and 1 filled bar is limited achievement. Decline to report is shown as no fill bars. And then there are several other terms that we use in public reporting, including does not apply. So for example, if you don't do those 4 procedures, then for the infection surveillance measure, it'll say does not apply. Did not measure, unable to calculate score, not available, and pending Leapfrog verification. For each of the measures, in addition to displaying the measure name and a description of our standard, and your overall progress towards achieving that standard. For many of the measures, we do display intermediate scoring variables, so patients and others can get even more information about how you're performing. Next slide. This is a screenshot of our same-day procedure search. And so, like I said, we want to make it as easy as possible for people to be able to find you. So they can go to this section of our search function. They can select adult or pediatric procedures and then search for facilities near them. In the profile section, you'll see that we include a question about what surgical specialties are performed at your facility. That information is used to inform this procedure search function. So if you say at my ASC, we do ophthalmology and only ophthalmology, then when folks search here for eye procedures, that's how they will find you. Next slide. As I mentioned, once those search results are produced, visitors can select up to 3 facilities to compare side by side. Even with the new ASC Survey 2.0, we have maintained some similar measures between HOPDs and ASCs to allow for that comparison across facilities who are performing those same-day procedures. So visitors can select, 2 or more ASCs, 2 ASCs, and an HOPD, et cetera, based on what same-day surgeries they perform. Next slide. The results also appear side by side. And again, you'll be able to do this for ASCs within your community and within your market as well. Next slide. As an incentive, as I said, to participate fully in our program, so upload that accreditation and submit that ASC Survey 2.0. We do have a top ASC program. You can actually go to our website and see our criteria from last year, which will be updated for this year. You can see videos from our 2025 dinner and award ceremony. And as I said last year, every top ASC actually participated in person. It was a very, very fun, exciting night. I will tell you, we give out a lot of awards. It does get loud. There's a lot of selfies taken, but it's, I think, one of the most fun things we do. Additionally, next slide, we also send ASCs free benchmarking reports so you can compare your results to other ASCs and HOPDs. This is a great opportunity for you to see how you rank nationally, which maybe you've never been able to do before. You can actually see how you're doing nationally against other ASCs and HOPDs. Next slide. We've also been, over the past 2 years, working on some case studies. So if you want to hear about other ASCs' experience working with Leapfrog through the ASC survey, we have a couple different case studies that we just published in the last couple months, one from Baptist Health South Florida, and one from the Center for Spine and Joint Replacement Surgery. And I think we might just have one more slide, and then I promise to leave time for questions. Yes, resources. Lots and lots and lots of free resources available to help you. We have tons of information on our website about all 3 program components. That scoring algorithm PDF that details every single scoring algorithm. We have an ASC Survey 2.0 binder to help you collect the documentation that you'll need to submit the ASC survey. We have these free town hall calls. You can download the recordings and the PowerPoint presentations. And we have a dedicated help desk, and I'll put that help desk URL in the chat in just a second. You can submit tickets, you can ask for a phone call, you can do a one-on-one orientation with your team. Next slide. We have a dedicated section of our website, leapfroggroup.org/ASC, that includes all the information you need, such as requesting a security code and asking questions of our help desk. And again, these slides are going to be distributed for you, to you, so you'll have all this information as well. And so with that, thank you so much for your time today. And I'm going to pause and I'll take a look in the chat and see if there are any questions.
Thank you, Missy, so much for sharing all that information, which we know is a lot, is exactly why we recorded it, exactly why there are so many links and resources for folks to peruse at their own kind of convenience. And then, as I mentioned earlier on, we are always here. If you have any questions, you are always welcome to reach out directly to Leapfrog. Missy put that help desk link in the chat box, but many facilities do like having a person they can reach directly or a little bit more quickly, although the help desk is quick, but they're responding to lots of requests. So you can always reach out to us at the Quality Institute. Oftentimes we have the answer or we know where to point you in the right direction. So you can reach out to us as well. But I do see a question in the chat box about survey results are exclusively from data reported from the ASC QR and OAS HCAPS. No actual in-person survey. Can you clarify, Missy?
Yeah, so no. So the ASC QR components are totally separate from the ASC survey reporting. So for the ASC survey reporting, you will need an actual person to review those questions, reporting periods, measure specifications, do the data collection, which again, we estimate to be about 10 hours, and then enter that data into the online survey tool. And we're happy to do a formal orientation with your team on survey participation. If that's something that would be helpful, just go ahead and reach out to the help desk.
Thank you, Missy. So there is a little bit of work that you all have to do on the back end. And then if you want to submit additional quality and safety information, that's that voluntary part that Missy was talking about. That is something that you would submit for your own institution. But no, the Leapfrog Group does not come in person to do any surveying on site.
Correct.
For the help desk, they don't have a direct number that's given out to individuals, only because, again, there's so many requests coming from across the country. It just helps them to organize and respond in a timely manner and in order. So if you reach out to the help desk link, you can request a phone call and they will provide contact information and set that up. But it just helps them keep a little bit of context as to who's reaching out and then in the order of which individuals are reaching out and who's the best person to respond. They have a number of staff members who kind of are experts in different areas. So they just want to get you the best help possible and the right help. So you can request a phone number to chat, but they don't have one for you to call directly at first.
Absolutely.
There is a question around who typically completes the information or completes the survey.
Yeah, so I would say it varies from ASC to ASC, particularly based on the size of the ASC. So in a lot of single specialty facilities, there may be like an administrative person who's coordinating it and then working with others to help assemble all the data and run the reports, etc. In larger facilities, there may be someone whose responsibility is quality. Maybe it's the person who's responsible for submitting data to the CMS ASC QR program. There's no specific person that has to be the lead. There's a lot of opportunities for different people to lead and play supporting roles. And based on the size and composition of your facility, we're happy to help you organize that and share any best practices or tips with you as well. And so if you want to go ahead and contact the help desk, that's a great topic during one of our one-on-one orientations, which typically take only about 30 minutes.
And I'm trying to multitask here, just flagging. Missy, I think your message only went to us hosts. So I am re-putting in the link for the help desk out to everybody.
Okay, perfect.
There is a question that you mentioned the publicly reported ASC data can be compared to hospital outpatient departments. Are hospital outpatient departments scored the same way using the same measures?
They're scored the same way using some, but not all of the same measures. Okay, so for example, both hospitals and ASCs report on Leapfrog's hand hygiene standard. In hospitals, however, that hand hygiene standard is unit-based. In ASCs, the hand hygiene standard is facility-based. And there are other measures as well where hospitals and ASCs are reporting on them, but the ASC version of the measure has really been tailored based on ASC specific operations, but it does allow, I think, for a very valuable comparison between HOPDs for several of the measures. So, for example, for our total hip and knee national volume standards and also our bariatric volume standards, it is exactly the same for hospitals and ASCs.
Thank you, Missy. And I did have a couple of sites reach out to me in the last couple of weeks with comments around that they were planning to complete the survey on the back end. They really want to see how they're going to do before anything gets published. So they're not intending to submit. And I think there's a little bit of confusion there around like them being able to, facilities being able to kind of enter in the information and see what will get published, publicly versus, the requirements around just automatically submitting. Can you just clarify for folks what they're able to see before it's submitted?
Absolutely. So if you've never done a Leapfrog ASC survey before, what I highly recommend, because everything is available on our website in a PDF version, download the hard copy of the ASC survey, the PDF, read the measure specifications, look at the reporting periods, get out a pencil, just enter your responses into the survey, the paper survey. Then you can use the scoring algorithms document that I just talked about and actually go through the scoring algorithms one by one and say, okay, for this measure, we said yes, no, yes, no, yes, no. And based on that, our scored result, according to Leapfrog, is going to be some achievement or considerable achievement, right? So that's exactly what you can do using the PDF of the hard copy of the survey and the PDF scoring algorithms document. If you go ahead and then enter that information into the online survey, affirm it and submit it, that is automatically going to be scored and publicly reported. And so if you just want to see what your scores will be, you can do that by filling out the paper survey and using the scoring algorithms document that we make available. If you need help translating those scoring algorithms, that's when, again, you can contact the help desk. We can get on a call with you and we can do that together if you have any questions.
And I see another question. Once registered, can you have more than one user who I believe helps support entering in the information?
Absolutely. So once you submit your security code request, you can submit multiple security code requests for folks in your facility. But again, usually a lot of people help fill out the hard copy of the survey, but only one person really needs to be responsible for entering it into the online survey tool. But if you want multiple people to do that, then you can certainly just submit multiple security code requests.
If there are multiple people entering in the information online, do they have an opportunity to kind of save it and have somebody look it over before they hit submit?
Yep, absolutely. It auto saves as you fill it out. You just need to make sure internally you manage those expectations.
Okay, great. Thank you. I know we have just about a minute left, so certainly if there's any questions that come to mind, you can throw them in the chat box and we'll follow up with Missy afterwards, or you can reach out to us anytime following today's webinar. We're happy to either provide the answer if we know it or connect you to Leapfrog if they can better provide a response. So with that, I'm going to just hand it over to my colleague, Christine, who just has a couple of closing remarks before we head out for today. Thank you, Missy.
Thanks.
Christine, I think you should be able to come off video and you'll be on.
Hi, everyone. I'm not sure if my video is working here, but want to just say thank you all for being able to join us today. We want to say a special thank you to Missy for being able to join us on behalf of the Leapfrog Group. Thank you for your time with engaging around Leapfrog and how we could better engage around Leapfrog as well with benchmarking, reporting, the different types of standards. You gave us some marks to look forward towards the deadline from June 30th all the way up to November 30th as well. It's really given us some time to reflect. From the Quality Institute side, just like Adelisa mentioned, please feel free to engage with us. We'd be happy to support whether that's technical assistance, any type of opportunities for collaboration, but really supporting your journey and completing the survey. And we thank you for your quality, your time and commitment towards quality and advancing the health of the patients that you serve. All this information will be shared back with you all today via email. And please also join us really at the Quality Institute website where we'll have a lot of this information stored. Thank you all, everyone, again, and we look forward to seeing you in the future.
Thanks, everyone.